the release from PMH on the DRHC from earlier today, or from yesterday, I mean. Looking at the pictures from 16 days after the flooding, the damage looks a lot worse than I think a lot of people realized. So with the assessments from contractors and engineers over the past few weeks, what have their main focuses been?
So our restoration company has to evaluate the damage fully. And so what they're doing as they clean up the space is they're also taking an inventory of all the damage, taking photos of each room, of all the items that will require replacement through insurance, and really painstakingly working to clean spaces in a way that we can access the electrical and mechanical equipment and the clinical equipment that was damaged during the flooding.
And does PMH and Shared Health and the DRHC have any timeline as to when we can expect at least the assessments to be wrapped up and for you guys to have those final reports in your hands?
Yeah, we're definitely asking for those and wanting them as soon as we can. Our engineering contracted firm that we're working with needs to take a full evaluation of the building and clearly understand the damage. One of the main barriers to getting that completed is they can't yet access the crawl space. It is still full of water and silt, and so they are working to remove that so they can fully evaluate the wiring and the infrastructure in those spaces to understand the degree of damage and what needs to be replaced.
I guess one of the prevailing thoughts around town is that it seems to be an all or nothing approach to opening the hospital. People are wondering why there can't be temporary power and air handling put in place to get things going.
Yeah. Thank you, Sean, for that. I think that it's not simple. Everything is intertwined here. A hospital requires a significant amount of power to run. The medical gases, for instance, so the oxygen, the suction, and the gases that are required in the operating room and obstetrical care, they alone require probably the most significant amounts of power. All of the diagnostics services in the building require a significant amount of power. Those two systems have to be in place before we can do anything in the building, and we need to have our electrical infrastructure in place before we can power up the HVAC systems and the mechanical structures in the building. So it's not an all or nothing approach. It's not as simple as hooking up an external generator and turning everything on. The building requires so much power that that's not an option. And so we do need to have that electrical infrastructure and the mechanical infrastructure in place before we can resurrect services, and also ensuring the building is safe to occupy. This is a clinical space. It is not a residential space. We need to ensure that everything is safe, and safety guides all of our decision making as we move through this process.
So really not much different than last week.
In terms of the timelines, no.
Okay.
With the DRHC being in a state of full closure for pretty much an indeterminate amount of time at this point, where does PMH stand on restoring healthcare basics at the very least, like a functioning emergency department or diagnostic services to the immediate Dauphin area? I know that we do have, I guess, buffed up supports in Grandview and in St. Rose in the meantime, but when can we expect an emergency department diagnostic services here within Dauphin?
So our first step, as I've spoken about, is reestablishing diagnostic services in the community so that people don't have to travel for lab work and basic X-ray and basic ECG support. So perhaps I could ask Dr. Socorro to speak to the work that Shared Health is taking to establish that service back in the community.
Thank you, Tina. So the work is continuing as a priority for diagnostic services to Shared Health to establish basic, as we say, diagnostic services in the community. And these basic diagnostic services will be for the non-urgent patients and patients that are not symptomatic, because patients who are ill are advised not to be seeking these services because they are more likely to need interventions from emergency or inpatients. For those patients, we continue to urge them to report to the nearest emergency department, which has the appropriate diagnostics. For all other patients that have scheduled appointments and are for the regular, we are working endlessly to be able to have a phlebotomy service, an EKG service, and an X-ray service. And these services are being located within the community, but it has to be done in compliance with the Health Standards Act, but also with the accreditation standards, which means that the facility to which we operate has to meet the safety requirements of infection prevention, control, sterility, but also are not a source of harm to the patients that are working on it. It is our priority, and we hope to have those in the next few while. We don't have an exact concrete timeline, but that is something we're working with PMH and government as well.
So is there an opportunity for off-site things like dialysis and chemotherapy as well to cut down on the travel people are facing?
You're on mute.
I guess you didn't hear me. I'm sorry about that. So there are teams comprised of Prairie Mountain Health and Shared Health folks looking at those options. What might be possible to accommodate hemodialysis and oncology services back in Dauphin or the surrounding area as soon as possible. We are looking at every possible option, including, what would be possible in buildings in the community of Dauphin itself and the surrounding area, as well as mobile options to support those services. We have to consider safety first and ensure that we're meeting clinical standards by providing those services. So it is not as simple as moving equipment over to, a building in Dauphin. We have to ensure that the clinical standards are met in those environments. So much work, and clinical experts are involved in that planning. As for the question Ian had asked about emergency room services, so yes, St. Rose and Grandview have been enhanced to support the volumes that Dauphin was seeing. And that we know that St. Rose is an older facility and is challenged in that smaller space to meet the increased demands. And so we are looking to see what we can do to enhance that environment and ensure that care can be provided, as well as it was done in Dauphin. And so looking to see what we can do within that environment to make things better. We are looking at all available options that might be accessible from temporary support. But I think first and foremost, it's important to work with what we have to see what can be done to ensure that we can do that most appropriately.
So the local MP has also expressed some concern over the level of communication between your organization and healthcare professionals. Are you hearing those concerns from your doctors and nurses as well?
No, we've been in regular contact with local officials and our staff on a regular basis.
I think that does it for me.
Thank you, Sean.
I've still got just a couple more. So speaking a little bit more on the communication, more towards the public, over the next number of months while the DRHC is started to get repaired, what can we expect from PMH, from Shared Health, when it comes to regular updates to just the general public?
Our intent is to provide those updates on a regular basis, as we discussed. And so this community update that you received in writing today with the photos, that update will be provided on a weekly basis as we move forward, and we can give updates to the media accordingly, locally.
I didn't actually receive that update. Can I get it sent to me? Okay, Sean.
Yeah. Sure. Yeah. So you didn't see the photos?
No.
Oh, I'm sorry. Yes, we'll make sure that you receive that.
Thank you.
And just one last thing as well, when it comes to emergency response services and patient transport services, making sure that people are able to get from Dauphin and the surrounding area to wherever they do need care, especially in the case of ambulances and STARS, seeing now especially that one of the STARS area ambulances is repositioned to Brandon. What, I guess, can we expect from that side of things in the coming months as you guys continue to progress on the DRHC, Basically, the big question is, will we still see an adequate number of ambulances and ways to transport patients if absolutely needed?
Yeah, Ian, the answer is yes, you will. As you've mentioned, we have repositioned Star 7, the Star Air ambulance, from Winnipeg to Brandon for the specific issue. We've also repositioned a low acuity, the contracted low acuity truck, which is patient transport services, to St. Rose for those appropriate transports. And within EMS operations, I think this has been stated before, but we use a process called system status management. It's a process of dynamically positioning and redeploying ambulances based on predictive mathematical modeling, which is done at MTCC, the 911 center in Brandon. This allows us to ensure that we're having faster response times, better coverage, and more efficient use of our resources. So definitely, we're doing everything we can to maintain those ambulances and staffing. So I don't think you'll see any breaks in coverage at all.
Okay, perfect. That'll do it for me. So if I could just get a copy of this sent to my email, that would be perfect.
Just one more thing to add, Sean and Ian. I wanted to ensure that the public is aware that we plan to hold a public town hall with government officials on July 30th at 6:30 p.m. The invites will be published on our Prairie Mountain Health website and social media.
Okay, perfect. Where do you guys plan on holding that town hall?
It'll be virtual. I'm sorry.
Okay, perfect.
So Blaine also mentioned that we might be doing this weekly. Is that an option?
I'm really hoping, yes.
Okay.
But even if we don't do this type of meeting weekly, you do expect to have a public update published to the PMH website weekly?
Yes. But
Okay,
I'm really hoping we can just have this meeting weekly as well in addition to that, because I think it's really important to ensure the public is aware of everything that's happening and informed and educated. So thank you for both of you for your efforts in that regard and educating the public and informing them of all the work that is occurring. We appreciate your support.
No problem.
All right, perfect. So then, I guess that'll do it for me.
Okay.
Perfect. Sometimes these meetings take a little bit long to convert, but I will send you both the recording as soon as I have it.
Perfect.
Yep, perfect. Just whenever you can.
Perfect. Okay, thanks all.
Thanks.